Hey guys, Dr. Brandon Schreiner here with Revive Chiropractic and Max Living. Today, I want to talk about the feet, right? So a lot of people are asking, I've got plantar fasciitis, I've got Morton's neuroma, I've got all these different, I'm a runner, like Jess, she's a marathoner, she's trying to run a marathon in every single state in the United States. Crazy, but we've got to make sure that we take care of our feet. So flat foot, and I've got scar tissue and stuff in there, or I'm getting what we call plantar fasciitis. So we're going to go through some things that you can be doing to make sure that your feet recover and you don't get those symptoms that can be pretty nasty. The first thing I always say is the body moves core to extremity. So please don't forget about your pelvis, your spine, getting adjusted on a regular basis, and making sure, if you're a patient, doing your home rehab, because if your pelvis is twisted, your knee is twisted, your ankle is twisted, and therefore your foot will compensate for that. So we've got to make sure that we're taking care of our spine, our nervous system, and we're not taking our foot off the gas when it comes to that. These exercises are not a replacement for chiropractic and for your home rehab exercises. So the first thing that we're going to do, this is awesome. So, my wife always wants me to massage her feet. And so, when we have a lacrosse ball, like, you can do a foot massage at any point in time. So, we're just going to put this on the ground, and Jess is just going to step on top of it, and she's just going to begin to kind of roll back and forth, especially down here on this medial arch. So you've got this arch of your foot, and whenever you've got things like plantar fasciitis and the arch of your foot collapses, you get a lot of scar tissue in through here. So rolling this ball back and forth onto that arch, and then finding a spot that doesn't feel good, and then kind of going back and forth on it. I mean, you can be at your desk working at a computer, which we all are, most people are right now, and just do this with your shoes off, right? I mean, you can do your shoes off. You can have anytime before you go run or after you go run. I mean, any time of the day, at night, you're watching TV with your family. This is a very, very easy thing to do. Spend 1 to 2 minutes on each foot, each side. Don't just go the bad side, also do the good side as well. The other thing that we want to do is we want to work on our calves. So what we're going to do is we're going to take our PVC pipe. I'm going to have Jess lay down on her bum, and she's going to begin to take, so let's just say her right foot is the problem. We're going to take that left foot, put it over top of that right foot, and begin to add some pressure. And what I'm going to do is, you've got a tendon right here. It's called your Achilles tendon. And that Achilles tendon, when it gets tight, it pulls this down. And when that pulls down, and every time you go to lift on your foot, it creates extreme pain. That's called plantar fasciitis. So what I want to do is I want to begin to break up all that scar tissue in her Achilles. When you find a spot that doesn't feel good, what are we going to do? We're going to push and smush down onto that Achilles, and you can see your face, right? You can see whenever it starts to get a little painful, and that's when you know you're in the right spot. And if you've got a partner, don't be afraid to push down on this and go back and forth. And here's the big one. We're going to work our way up onto that calf, okay? And you can feel it, right? It's starting to get tight. She's a runner. And then when we find that spot, we're going to go back and forth. She's going to breathe. So one thing, I don't want to see red face. I want to see in through the nose, out through the mouth, begin to breathe. Don't just do the good side, do the bad side as well. 1 to 2 minutes on each side. So we've taken the ball, and we've broken up the scar tissue here in the foot. And then we've gone here and we've broken up the scar tissue in what we call the Achilles tendon, and then the soleus that inserts up into the gastroc. If you don't have a PVC pipe, you can also do this. It's a little tougher, but way, way more difficult. So we can actually take this ball, begin to dig into that tissue and through there, and then make sure that we get up into that soleus back and forth, okay? So that's going to take care of the feet. Now, the one thing that I'll tell you as well is that when you're sleeping at night and you've got feet issues, make sure you kick the covers up and that your feet aren't curled down like this. Because if you've got plantar fasciitis and your feet are curled down, it's going to shrink that tissue. Kick the covers up and make sure your feet are like this. So that's your tip for your feet. Until the next video, I pray you guys have a healthy, happy, blessed day. Bye-bye.